House Call community, welcome back. We are here in season 7 and we're just delving into different areas of our bodies, of our lives. And you know, I love it when I can bring into the House Call community something that's very unique that we can integrate into our lives and that we can put in our little toolbox and pull out to have better health. And today we are sitting at the Advanced Integrative Health Group's office in Gambrel, Maryland, and I want to welcome Drs. Denise Tyson and Dr. Cindy Tran to the House Call community. Thank you so much for letting us come to your practice today.
Thank you for having us.
I am so excited because I met Dr. Denise Tyson through social media. I love that because I'm learning how to use social media and use it very productive. And we got a chance to connect and sat down and started realizing how much we have in common, not only have in common, but just in our mission for people to have wellness and better health. And I said, you know what, can you guys come and sit down in the community and tell our community about your practice? And she said, absolutely, no problem. So that's why we're here. So can you tell us what type of practice you all have?
Okay, so our practice is based on integrative health. Okay. And what that means is that we're offering complementary medicine type therapies that can integrate with Western medicine and what we know as our traditional medicine in the United States. We offer primarily acupuncture, Chinese medicine type of modalities like cupping, gua sha. We do electroacupuncture. We also do acupuncture detoxification. Yes, and we also practice other like touch medicine like Reiki. I'm also a certified Reiki practitioner. And within that we also are coaching our patients with nutrition and healthy habits. To do that. And while we're doing that, we're also looking at their diagnosis from Western medicine. We're looking at what their physicians have prescribed. We're also helping to support compliance, with their treatments, and also supplement with therapies that will actually enhance what they're getting from their practitioners or their primary care physician.
Wow, that is a great synopsis of what you offer here. While we were getting ready to start, Dr. Tran, you were telling me a little bit about your story, and I asked you, just kind of like, tell me a little bit about your story and how did you end up in this in medicine, right? And it was very interesting how you were telling me that it was kind of handed down in your family. Correct. But I love the way that you put it, that you now kind of put the theory behind it, and now you understand kind of what some of the what would we say, some of our folklore or what our parents probably told us. Could you just give us a little bit of your story? How did you come to this point?
So as I was growing up, I was, brought up to all these herbs and cupping, like Dr. Denise was listing, like the gua sha, which is scraping, and I didn't understand why any of that worked. I would ask my mom, Mommy, why are we doing this? Yeah. I know it works, but why? And she couldn't, she couldn't explain to me the actual theory behind it. So she would just give examples like, you wouldn't pee in your pants when you get older. And what she actually meant was incontinence, but she didn't know the technical terms. And then, I actually grew up with the thought of going to medical school, and then they said, oh, no, that's too stressful. And I thought myself that was too stressful. So I decided to go down the naturopathic route. And they said, well, those schools are way too far. Just stay home with us. And I decided to get into acupuncture, and that would just reinforce what I grew up with. And it also gave me, the knowledge and actual theory of why my mom and why she did all the things that she did. And I completely understand why she does all of those things now.
Exactly. It's amazing how when the science fits in,
correct,
and you go,
there's like an aha moment, literally in the middle of the classroom, like, oh, okay, so she did that in order to get rid of the cold, but she just said it in a completely different way.
Right, exactly. And that is exactly what we like to do here in the House Call community. We call it connecting our health dots and being able to bring all the little pieces together so that we can make better health choices.
Correct. Right.
And that's exactly what integrative medicine does. It helps give you the tools. It gives you the information. It gives you the foundation.
Correct.
So that you can now understand why I need to get more sleep or why I need to get more water.
Yeah, something as simple as those two things.
Exactly.
Right. Yeah.
Instead of just somebody telling you and you going,
just drink water.
Really mean?
Why?
Right. Why do I even need to do that?
And putting it in a language that everyone can understand.
Exactly. Exactly. Now, Dr. Tyson, you said something where you were talking about working with traditional or Western, we just call them Western. I don't really like the term traditional, but Western medicine and how you can become a complement to that.
Yes.
So we're gonna get to that point, but in getting to that, I want to ask, so who would benefit from coming to Advanced Integrative Health Group?
Well, all ages. So we have pediatric patients.
Really?
Yes.
Okay.
And children are wonderful because they're easy to treat. They take in, and so because they don't have all of the blocks that we have.
They're not as complicated.
They're not complicated
as we are.
They haven't developed all the layers and resistance that we have and all of the bad habits that we have. So when you treat them, it's quite simple to treat them. They take it in very easily, and they're very expressive about it as well. I love, treating kids. Wow. And then we have all of the adult groups. Different generations of groups.
Okay.
We have young people who come in who are under 30. Yeah, really? They come in. Yeah,
And are they looking for just to remain healthy, or are they actually treating maybe some type of specific problem?
We have different people. Some people have injury.
Okay.
From sports,
right?
And things like that. And then we have some people who simply just stressed out. From adult life.
Adulting.
From adulting, is it?
Pretty much.
It gets so complicated.
Which is why kids are so much easier.
Yes, because I'm still looking for the service counter for adulting. I need a refund.
Yes, exactly. So they come in and I'm really stressed out. We have patients who come in who, simply just had a bad relationship. Yeah, and they're trying to, get through that. Yeah, so emotional needs. Injuries, all type of issues, or they might have a chronic illness.
Okay.
That they've had a diagnosis and they want to get through that. And then we have group middle age group. Probably a lot of our patients are probably in the middle age group, and we have a lot of patients suffering from menopausal symptoms right now. Those hot flashes.
Yes.
Yes. Number one.
Yeah.
That's right. Exactly. I my background is OBGYN, and I am now at an integrative wellness center myself, and you are right. It's that whole wait a minute, something just happened.
Yes.
And it is interrupting my life tremendously.
Yes.
And they just want to feel better. They just want to feel healthy. It's not necessarily that I want to go back to my 20s because I have more wisdom. I know what I'm doing. I just want to feel better where I am.
Right. Correct. Just where I am.
That's where they are. So you've mapped out a variety of different groups that can come in to see you. So let's go to the part where it says, so then how do you now fit into the picture with the primary care doctor?
Okay, so the primary care physician, usually in their role, They're giving you an examination, performing some tests, you know, to see if you're well. And then you may be well.
Okay.
But you also may not be getting a lot of sleep. And that may not be something other than giving you probably a sedative or some type of sleeping aid that you buy in the drugstore. You may want to have some help with that. So that's one level of patient that we see. The physician can simply refer the patient here, and we'd be able to give them the therapy, and they'll be able to sleep better. We also have patients who, you know, they may be having pain, so they're seeing their physician and they're having pain. The physician has maybe prescribed different medication, or maybe it's, you know, it may not be working. We're also there that they can come to us to, you know, to get therapy, that we might be able to get to the center of pain, and probably without, you know, without medication. That they can do that. Maybe they've had medication, but they need, you know, they've been told you can't have any more medication because there's an end to that, and they're not seeing through. Then we can help them to get through with the pain, and also to help them not become dependent.
I like that.
Yeah, that is a big issue.
Yeah, on that medication.
And, you know, we're right now sitting in the state of Maryland, and now the big topic is the opioid crisis. And it's not just in Maryland, it's spreading across
nationwide,
our nation. And so to hear you say, we can really help you with pain issues, we can help you with this particular ailment, is very comforting. I mean, for somebody that's like, oh my goodness, I never thought that. And so what are you saying? So let's delve into maybe some of the therapies that can help. I love the whole pain issue, if we can. Dr. Tran, give us some if somebody comes in for pain.
Well, it depends on the type of pain.
I know I'm asking a very broad topic.
Such a broad topic. So anybody who comes in with an injury, we obviously can treat them with acupuncture using needles. And then there's actually a therapy called Moxibustion. I can't even say the word. Moxibustion, where we apply herbal heat. And usually in Western medicine, they encourage the use of ice to prevent swelling. But in Chinese medicine, the swelling is what enhances the immune system and trying to help us heal. So moxibustion is what we apply to an injury in order to speed up the recovery process. In the case where someone has chronic illness, something like, or not illness, pain, chronic pain, say from arthritis or any type of inflammation that they've had for a long time, we apply the knowledge of, okay, so if it's inflammation, that means that our body has a lot of what we call heat. Inflammation is just heat in theory. So we would just reverse that process and add coolness to that heat to kind of reduce the inflammation, to get rid of the pain. Now for someone who, you know, like you said, we're in the state of emergency for the opiates. We actually do detoxification too. So we actually clear out, you know, the drugs. Someone who's dependent on the drugs, we can detox that and help reduce pain as a process, as a supplement as well.
So now, once somebody comes to your practice, do they expect that now this is just part of their life? Do they have to come now for an indefinite amount of time? Or are you going to be able to give them some tools that they can then take away as well? So
with our treatment, we don't want you to come to us forever. We would like for you to heal and be able to come out of this with a way of life and daily habits that promote your continued healing and wellness. So usually when a patient comes in, we normally see them, it could be 4 to 6 treatments, and sometimes up to 10, depends on what you're coming in for. I have patients who's come in with shoulder pain, and after 4 treatments, they're fine. And they may not present themselves again until maybe, you know, there's another injury or something going on. Some patients may come in, it may be emotional issue like depression. Sometimes that takes longer, and they may stay with us for an extended period of time. And within that, we give our patients homework. So
homework is important.
Yeah.
Really?
Yeah,
okay, so what type now this is
yeah.
So what type of homework are we talking about?
Well, like you need to increase your fluid intake, water.
Number one.
Yeah.
Yes.
Try to go to bed by 9:00 p.m.
Ooh.
Wait, the
that was what?
rhythm.
Yeah. Try to go to bed by 9 p.m.
You talking lights out in my bed?
Yeah, phones off.
Yeah.
Ooh.
Yes.
Yes, ma'am.
Yeah.
Okay.
Yes.
Okay.
Yeah. And
Ouch, stepping on my toes.
Yeah,
Go ahead.
eat breakfast.
Eat breakfast.
Eat breakfast.
Mm-hmm.
Yeah.
See, this is something that everyone knows.
Mm-hmm.
But have a really hard time complying.
Exactly.
Eat breakfast.
Yeah, and we give you the homework, and you come back, and we will discuss it. Like, how did that feel to actually eat breakfast?
Every day. And a wholesome breakfast, not just a donut.
What was that, Dr. Tran? Not just a donut. Exactly.
Yeah.
Wow. So these are just life tools.
Life tools.
Right.
Mm-hmm.
Life tips, things that we should be doing that seems like you kind of help keep people back on track or get people back on track.
Right.
Or help them to understand this is how you fuel your body. This is how you take care of your body, and then your body will take care of you.
Yeah,
correct.
So
it's
we work,
free medicine.
Yeah, and we
it's
work
free medicine,
and we want the breakthroughs. Yeah, because it's amazing how someone comes in and they actually feel themselves healing and they feel well, and they say, I haven't felt this way in 10 years, in 15 years. I didn't know what that felt like, and they want to keep it.
Yes,
they want to hold on to that, and so you find that then they will do whatever it takes to be able, because they then realize what's at stake. I want to see my children grow up. I want to see, I want to see grandchildren. I want to keep, going, and if they go on that path to where they're basically destroying their chances,
right,
and by not doing the simple things,
and something as simple as falling asleep. It's funny that 80% of the time our patients fall asleep on the table, and that's really all they need is to feel better. Sleep and drink water and eat breakfast.
And I was confessing to you all when I came in that this week I didn't do those simple things. And my body shut down on me yesterday. And it literally knocked me into the bed. It's just like, no, you didn't drink your water like you've been doing for very religiously now for the last 2 or 3 months. And you did not take care of yourself. You were not sleeping. You were pushing yourself too much. You were worrying too much on things that you have no control over. And it literally said,
took a toll.
Boom.
Yeah. Correct.
And I was like, oh, okay, pause.
Yeah.
Take a step back. Let's get back on. Let's get back on track. Let's get back on track. Now, I know a lot of people are going to wonder the money part.
Yes.
Insurance. Is this covered by insurance?
Yes, it is. It's
covered by most. Surprise, surprise.
Really?
Yes. Yeah, most insurances cover, and we accept, most of the insurances that are out there. And we also, work with patients. We have a self-pay plan, but we also work with people. We want you to feel good.
Yes.
Be well. So sure, so it is a convenience for most of our patients that they can come in, and we process the claim for you. So you just come in and
say, here's my such and such
if you
card.
have Blue Cross or United Healthcare, Aetna, Cigna, all of the major insurance companies.
Yay.
It's covered.
Yay. And this is what is so beautiful about this, because you can talk to their primary care. You see what's going on with them from their primary care's point of view. You're able to give them tools. You're able to kind of take up the slack that the primary care sometimes just can't do.
Right.
Just because of time, or just because of the way that their practice may run. So you're able to fill in that gap.
Yes.
And hold up that floor so that the patient can be compliant. Yes. The patient can understand fully what's going on. I had so many patients that would come back to me and say, I had no idea what I'm supposed to be doing. I don't know why I'm taking this. I don't know why they're doing this. I don't know why they ordered this. Because just in the whole scheme of things, sometimes you just don't have the time, and the patient may be getting so much information that they can't totally process everything. And so with them coming to the practice here, they're able to, like I say, build that gap, fill in that gap, and go, okay, now I understand. Right. And now I can be part of my own team and help to be able to make better health choices.
Yeah, because we're there because the patient will go and see their primary care physician, and they may not get their next appointment for another 6 months. Or it's an annual exam, and they may go in for a sick visit, but they come here like every week, and some more than once a week. So so we're able to see them. And so we are also, as acupuncturists, we're trained in biomedicine. We're trained in recognizing other red flags. We're trained to read the lab reports and all of that. So we're able to assist in the the well-being of the patient. Okay. And if we see signs of pre-diabetes, like they're having excessive thirst, they're having peripheral edema, the swelling on their ankles. Here we are. We can call up your primary care physician, and we can say, look, this is what I'm seeing. Then maybe this person needs a blood glucose test or something like that. So we are definitely here because we see the patient more often.
Okay.
It's a great feedback loop system.
Yeah.
Wow. Now, I know I'm looking at our time, and I want to ask a couple more questions. Sure. And I know this next one may be asking to take us to medical school with you. Yeah. But some people just may not understand, what is acupuncture? What does it really accomplish? Why would I even do acupuncture? What is it doing for me? Like, what's the physiology or the theory behind it? And what the other big thing is cupping, that I know is starting to have a lot more social awareness. And then Reiki therapy. If you could just touch on those three big ones for me, just so that people can understand what they are, because I'm coming to know myself that when I say acupuncture, some people look at me, I don't know about that, I don't know, and then cupping. Well, what is that really supposed to do? So like I said, I understand I'm asking you to probably take us to school with you, but if you could just kind of condense it so that our community can understand it, so they go, oh, okay, that's probably something I would like to be able to put in my toolbox.
Okay, well, I'll let Dr. Tyson talk about acupuncture itself, and I'll speak on the cupping.
Yes.
Okay.
Yes, Dr. Tran loves cupping. So acupuncture, we take a very fine needle. The needle is like a strand of hair. Okay. It would take, I know a lot of people say, I'm afraid of needles, but take about 20 of those needles to fit in a hypodermic. So it's very thin. And when we go to a particular point, the body is divided into like meridians, and they pretty much match the physiological systems that we're used to, like cardiovascular, neurology, and all that. So when we go into a point, the needle goes in, and basically it stimulates the neurological and muscular system. And that also triggers in response to and triggers release of endorphins. It can release any number of neurotransmitters or in your lymphatic system. It also turns off your sympathetic system. So that your fight or flight type system, and which most Americans are in probably 90% of the day.
Exactly.
Yeah.
Everybody's hypervigilant.
Yeah. And so it responds to, your central nervous system turns that down, and then you're able to, to find calm and also release your natural endorphins, which then relieve your pain, and also responds to turning down your stress response system, which then, will turn that inflammation in your lymphatic system that's trying to fight something that's there.
Yes. Yes.
Yeah, and so that's basically how it works. So
That's awesome.
Chinese medicine, 3,000 years old.
Yeah,
They already knew
yeah,
this.
Yeah.
Yeah.
Exactly. Oh, wow.
And cupping does all of the things that the acupuncture needles also do, except it also does it more on a muscular level as well. I love cupping. This is what I grew up on. I actually got it done yesterday, so you can actually see the marks on my neck. But Michael Phelps made this very famous.
Yes, he did.
The famous circles, mysterious circles on his back. So cupping is just pretty much like a massage, except with massage, what they do is they apply positive pressure, and cupping is just the suctioning of the muscles. So that's what we call negative pressure. So it's pulling on the muscles and pulling on the skin, and what that does is it brings blood flow to that area. It clears out toxins. It loosens up the muscles, gets rid of muscle tension. If you wake up with a stiff neck, take a cup to the neck, and it'll release all of that, and it pretty much takes like a stiff rubber band and loosens it up, and you feel like a noodle all over again. But it's great. Yeah, it feels great. Well, it might be a little painful, but it feels great afterwards.
Okay.
You'll loosen up a lot, and it clears all of the muscular problems that a lot of people have, actually, and that's why a lot of athletes do it.
Yes, yes, and that, like you said, Michael Phelps made it very
he made it very popular.
Yeah. And I'm telling you now, our kids love YouTube, and they watch a lot of YouTubers, and some of them now are starting to do cupping. They're starting to show. There's one in particular. He's really, I think he's on a journey for wellness and health, and so he's showing the younger kids actually some integrative medicine techniques, and it's really kind of cool. And I kind of look over and I go, oh, that's actually something that's not foolishness that you're watching.
It actually makes sense.
Right. I was like, oh, okay, that's good. That's good. And they're coming and they're asking and they're saying, oh, so what is this and what does it do? And that's what I'm thank you so much for giving us that explanation. That's very, very clear cut as to how it can help. Just those two examples of waking up with a stiff neck, or just that whole fight or flight. We're constantly stressed out, and I was telling my kids the other day, you don't need to jump at everything. There was a thunderstorm, and every time the thunder rolled, it was like and I was like, don't do that. I said, you're just increasing all of your sympathy. It's just like now you're constantly putting
your body in stress mode.
What is that? And
unnecessarily.
Then we went into a nice little physiology lesson. And I was like, oh, okay, all right. So before we go, we usually ask our guests to give our community a tip of the day. It can be on anything that's on your heart or the topic that we're talking about, which is integrative medicine. So if each of you would be so kind to give our community a tip of the day, we would be honored.
Okay.
Do you want to say drink water, or do you want to say something?
Well, that's a big one, and I think it's something that's underestimated is drinking water.
Yes.
And a lot of people go to sugary drinks, or I'm just going to drink coffee and tea all day. But you really do need to just drink water. It's important for the acidity of your blood, to add water and to have your blood at a nice consistency. I mean, we're made up of water.
Exactly.
Right.
Exactly.
Yeah, and it also helps for the detoxing the body. So water in, water out. Yeah, and I think it's very important. And I have patients who come in all the time and they don't drink water.
I am so surprised at that too. They're like, oh, I don't drink water.
Yeah, after our treatment, I have water here, and I take it into the room, and I said, drink this.
Drink it before you leave.
Before you leave.
At least I have some evidence.
Yeah, right.
Yep.
Drink this before you leave. I like that. Dr. Tran.
I say sleep, and when I say sleep, I mean going with the circadian rhythm, going with the sun. The sun rising is when we're awake. The sun going down is when we're supposed to be asleep. So I say the farmers have the best cycle of sleep. You want to be in bed at night when the sun is down, and you want to be up when the sun comes up, and that's what good sleep is.
Yes.
So not when we're, in the middle of the day at noon and taking a 5-hour nap and being awake all night. So that's not, the type of sleep we're talking about. We're talking about the correct amount of sleep and the correct cycle of sleep.
I like that.
And there's one motivation to sleep is that, and maybe people may not know, is that one of the important mechanisms that happens for losing weight is when you sleep.
Oh, yes, weight management.
That's when you burn the calories.
Getting enough sleep along with drinking enough water.
Wow.
The perfect recipe for weight loss. No diet, well, not no diet necessary, but a healthy diet as well.
Yeah. Thank you. Wow, we got some great nuggets here. Thank you so much. Oh my goodness. Thank you for letting us come to your place, your integrative medicine practice here in Gambrels, Maryland. Are you all taking new patients?
Yes.
We're taking new patients.
Yes,
so we will put your links in the copy and a way that you can get in touch with you. Thank you so much. And with that, community, we will see you guys back here next time. Bye now.
Thank you very much.
Thank you so much for coming.